Now, first, what I'll tell you is that this analysis comes from CMS.gov and is really part of an entire data set that looks at many specific aspects of healthcare. And contractual allowances is just one piece of the puzzle. And so, one of the things we found interesting is that by state, it varies greatly. And so, if you live in, let's say, Nevada, Florida, or New Jersey, then your contractual allowances are north of 80%. What this means is that if you live in any of these three states, if you walk into any hospital, then you can expect a contractual allowance or a decrease in your top line charge of 80% and be negotiated by your insurance company. So if you don't have an insurance company, you may be missing out, and you probably are missing out on that 80% discount because hospitals will automatically give you that top line charge and expect you to negotiate down. But insurance companies essentially have enough volume to be able to negotiate down to the lowest rates. And so that's how contractual allowances work. Now, there are other states at the bottom here, like North Dakota, Montana, Maine, and Maryland, where theirs are extremely low. Maryland is an outlier where the contractual allowances for Maryland are 12%. And so what this means is that in contrast to having an 80% discount, if you walk into any hospital in Maryland, then you're going to have a 12% discount, which is I suppose reasonable, but it depends on the total costs of healthcare within Maryland. Now the next states are North Dakota, Montana, and Maine, and Vermont, and it goes up on the list. But even these states, which are the lowest or one of the lowest, still have contractual allowances of 45 to 50%, which is still quite high, but that's the world we live in. Another thing I found extremely interesting is that you have all of these states here, but on an average basis, you'll have the states in the Northwest, which have a lower contractual allowance than the ones in the South. And so the ones in the South certainly have high contractual allowances, north of 75%, including Arizona, Texas, Florida, and all of these states. And one of the reasons I would suspect why is because you have more retirees in those states who need procedures that are obviously at a higher cost. So then you will obviously negotiate down even more. And so I thought that was very, very interesting that you have Maine, you have these northern states up here that don't have high contractual allowances and they're more in line with the average, but then your southern states have very, very high contractual allowances. And we can see that in the data when we go to the state and the specific hospital level. Now, the other thing that I find very interesting is that when you look at contractual allowances on a trend basis, then what you'll find is that the gap between your total costs within a hospital or within a clinic is increasing at a steady rate, while your contractual allowances are increasing at an even greater amount. And so one of the ways we're able to measure contractual allowances is because we can measure the total hospital charges that hospitals charge on an aggregate level across over 5,000 hospitals. And then we can take the net patient revenue, which is what we assume is the revenue that the hospitals bring in on an aggregate basis. And so as you can see, in 2011, you had hospital charges of $2 trillion, and the net revenue on this was around $700 billion. Now, today, you have total hospital charges that are $4.6 trillion and really close to $5 trillion. And you have net patient revenue close to $1 trillion. And so net patient revenue really increased from 700 billion to $1 trillion in 10 years, while the total charges increased from two to five. So it's almost more than doubled as far as hospital charges are concerned, while the net patient revenue did certainly not double. Another way to look at it is on a percentage basis. And so if we take if we take the hospital charges over net patient revenue, then we get what we're arriving at, our assumed contractual allowance. And so, as you can see within this chart, it is increased by, let's say, 66%, all the way north of 80% in 2022. 75%. And so, as you can see, this trend has increased drastically, where before it was at 66%, and it's gone up a whole 10% in the past 10 years. And it's leveled out, but my expectation is that in the next 5 to 10 years, it will certainly increase, and we could see contractual allowances close to 80%, certainly 68 to 69% by the end of this decade, which is quite astounding, but that is the world we live in. And so when people ask about alternate ways of paying for healthcare, I would point right to the contractual allowances. The higher the contractual allowance percentage, the more you have to rely on insurance companies to negotiate, and the more negotiating power they will have to bring those healthcare costs down. And then you have this relationship between hospitals and providers and insurance companies that essentially makes sure that this process is more and more enforced as contractual allowances increase greater and greater. Okay, so that's the overview. We've talked about contractual allowances by state, and we've talked about the trend, which is very, very astounding and very, very stark, where contractual allowances are increasing on a percentage basis year over year.